Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey. Insights that matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Healthy Insights That Matter. October is Breast Cancer Awareness Month. This is a topic that is very close to my heart and to my chest, since I'm a two-time breast cancer survivor, diagnosed in my 30s and then diagnosed in my other breast at the age of 40, and I'm now a 32-year survivor and thankful that I can say that. I've worked in this field for nearly 40 years and am the former administrative director of the breast center at Johns Hopkins and have taken care of a myriad of patients with all stages, prognostic factors, and outcomes. So I'm really excited that we're going to be talking today about a topic that a lot of people don't know about or may not have accurate information about. Today, I'm being joined by medical oncologist, Dr. Channing Paller. She is an associate professor of oncology in the Johns Hopkins University School of Medicine and also an associate director of oncology for the Johns Hopkins Clinical Research Network. So thank you so much, Dr. Paller, for joining us today.
Thank you so much for having me.
This particular topic that we're going to be dealing with is one that I'm familiar with, and I'm going to go back almost 30 years with some of the myths, undo the myths and instill the facts. And that's what I'm going to have us set out to do today, as well as provide, I think, a new sense of hope. Because whenever we can do something ourselves to reduce our risk of getting breast cancer, reduce our risk of getting breast cancer again, that's quite empowering. And I find that it calms my nerves. It's when I don't have control over things that I get quite anxious. So we're going to talk about a study that Dr. Paller has done that looks at natural compounds derived from soy and other plants that can reduce breast cancer recurrence as well as improve survival. According to the National Breast Cancer Foundation, 1 in 8 women in the United States will be diagnosed with breast cancer sometime in their lifetime. In 2024, it is estimated that 310,720 women will be diagnosed with invasive breast cancer. And I want to emphasize invasive because that's the kind that can take your life. There are also, in addition to that, about 45,000 women who are diagnosed with ductal carcinoma in situ, non-invasive breast cancer. And I would be remiss if I also didn't mention that about 2,000 men will be diagnosed this year also with breast cancer. There will be, or estimated to be, 42,250 women in the United States who actually will die of breast cancer this year. The risk of breast cancer recurrence very much depends on the type of breast cancer that they have, the staging of the initial breast cancer, not to be confused with grade. And typically the highest risk of recurrence is during the first few years after treatment and decreases over time. I will say that it doesn't matter if a woman has stage 0, which is ductal carcinoma in situ, or stage 3C, which kisses right up to metastatic disease. Their anxiety about recurrence has been measured to be almost equivalent. And I've always found that fascinating, even though they're told what their risk would be, and the number may be lower, the number may be high. Women psychologically treat it all as high. They're checking their breasts in the shower every morning, figuring today's the day I'm going to have recurrence. Any ache or pain, they're calling somebody, usually me, and saying, do I have metastatic disease now? We do have a large number of women whose breast cancer is stimulated to grow by estrogen or sometimes progesterone, and these are known as prognostic factors. And we'll be talking a little bit more about that shortly. I'm very confident that our audience has at least one individual, family member, or close friend who has gone through a diagnosis and treatment of breast cancer, and we certainly do hope that they became a long-term survivor like myself. So before we get really started, I'd like us to discuss a myth that circulated for several years, and I heard this myth all the way back to almost 30 years ago. And it has to do with the ingestion of soy causing an increase in estrogen that increases risk of developing breast cancer. So soybeans contain naturally occurring plant compounds called isoflavones, which are a class of phytoestrogens. Most people assume that phytoestrogens promote estrogen activity in the body, but the reality is that phytoestrogens act as inhibitors. So if we can talk a little bit first about what do we mean when we say an estrogen receptor, and how does that work when we are discussing breast cancer?
That's a great question. I remember that myth when my grandmother had breast cancer way back 30 years ago, and it was good to eat soy and then it wasn't good to eat soy. And so I think these findings today are really exciting to let us know which plants could be healthy for us. So these phytoestrogens are one of the phytonutrients that we studied. So what are phytonutrients? They're bioactive phytochemicals or plant-derived compounds that are produced by the plant as secondary metabolites. So they are things that have activity against cancer and can help keep our body healthy. And so they are ways that the phytoestrogens can actually act as inhibitors of the estrogen receptor. So we used to think that they would promote estrogenic activity in the body, but in reality, the phytoestrogens act as inhibitors of the estrogen receptors when you ingest them from these plant sources. So in fact, it turns out that they're not as bad as we thought. In fact, they might be good.
When we're looking at estrogen, I always tell my patients that if there is estrogen in your body, that doesn't mean that when you go through menopause, you no longer have estrogen. And I think that's also a myth, that your adrenal glands are still doing their job. Your body fat, unfortunately, is doing its job too in holding on to estrogen on your behalf. And so I've always told patients, if your breast cancer tumor is estrogen receptor positive, then that tells us that the fuel for your breast cancer to grow, a key component of it, would be estrogen. And whatever we can do to block those breast cancer cells from receiving estrogen, that would be a good thing to do. But I think because people just hear you say phytoestrogen, they just hear estrogen and they don't hear the phyto part, and they probably don't know what the phyto part means anyway, and they just start to freak out. Remember, there were patients probably 25 years ago who I ate tofu every other day. Was that okay? I don't know how she picked every other, it's, oh my goodness. And also other plant compounds too that we'll talk about in a little bit. What I am curious to ask you about, if I may, is I've read before in research studies that Asian women have a 1 in 22 risk of getting breast cancer if they're living in their home country. But if they come over here to the United States and then adopt our Western diet, after some years, that protection seems to have fallen aside, and they're right in there with us being the 1 in 8 women. So there certainly is something to be said.
Absolutely. I mean, we think a lot of that has to do with the soy isoflavones they have in their diet. So again, this is another plant-derived compound with estrogenic activity. And so their main sources of diet, isoflavones, were soybeans, soy products, even barley, fava beans, broccoli, cauliflower. They eat a lot healthier than we do.
And they start eating this very young. I mean, they're young.
That's right.
Probably as soon as they finish breastfeeding, they've got ground up tofu in their baby food, I would suspect.
I would too.
Yes. Can you tell us a little bit more about what your study was intended to examine? And then let's talk some about what did you discover and what action might our listeners want to take as a result of what you've discovered from this study?
Absolutely. So we looked at the dietary intake of 4 plants and their phytonutrients on breast cancer survival outcomes. So first was soybean. Second was something called lignans. So this is found in whole grains, legumes, seeds, and some fruits and vegetables. The third one was cruciferous vegetables. So those are our cabbage family, our leafy greens, broccoli, Brussels sprouts, chard, kale, radishes, turnips. And fourth was green tea, also ingested in Asian cultures commonly. Our goals were to determine the impact these exposures had on breast cancer outcomes, the effects of different dosages when that information was available, and the ideal timeline for initiating them. This meta-analysis investigated the impact of selected phytonutrients on breast cancer outcomes in patients who had a diagnosis of breast cancer. And then we looked at phytonutrient consumption, which is quite prevalent following a breast cancer diagnosis. And the reason they change their behavior is they want to prevent recurrence or prevent metastases or generally prolong life. Exposure to phytonutrients and their sources may be through established dietary habits prior to diagnosis, dietary modification, or supplements following diagnosis.
What did your research find?
Well, before I start revealing our findings and our methods, I think it's critically important to stress that these studies were conducted on women who received medical and/or surgical treatment for breast cancer, and that these foods and phytonutrients should not be considered as alternatives to treatment. So this is in addition. So our study analyzed evidence from 32 studies on breast cancer recurrence and mortality and all-cause mortality to gain a better understanding of the impact of these plant exposures, the dosage, and whether the timing of their introduction impacts prognosis. So we found, looking first at 6 studies, a meta-analysis of soy isoflavones, this was associated with a 26% risk reduction of breast cancer recurrence. And the greatest reduction we saw was at approximately 60 milligrams per day. This is equivalent to 2 to 3 servings per day, where 1 serving equates to 1 cup of soy milk, 3 ounces of tofu, or half a cup of cooked soybeans. Although there was a significant finding to prevent breast cancer recurrence, the effect of soy consumption on the risk of mortality was much smaller and not statistically significant, but was seen in the range of 1 to 2 servings per day.
And when you're saying recurrence, are you referring to a local recurrence in the breast that may have had a lumpectomy surgery done, a regional recurrence such as disease returning in their lymph nodes in their underarm, or distant recurrence, which is, as you know, stage 4 breast cancer when it has reached other organ sites? And that obviously is something that she's going to eventually end up dying from.
The 6 studies included all of those. They were not always specific into which of those 3 recurrences. So it was any sort of recurrence.
Okay.
Another finding we had that was statistically significant was the finding that enterolactone, so this is a compound that comes from lignans, which we talked about before, but it's metabolized in our intestines or our gut. So lignans are found in seeds, nuts, legumes, plants, and high levels are found in flax seeds, cashew nuts, broccoli, Brussels sprouts, and other sources. So this enterolactone was found to reduce the risk of breast cancer mortality by 28% and death from any cause by 31%, particularly among postmenopausal women. The next question I asked was, how much should I take? Unfortunately, it's not possible to calculate the effective dose of lignans in the diet from these enterolactone findings because everybody's gut microbiome acts differently, and we weren't able to control that in these studies. I will tell you that 1 teaspoon of flaxseed is approximately 9 milligrams of lignans, which is about 1 dose.
In looking at a large majority of women being postmenopausal, I think about them having estrogen receptor positive breast cancer cells and oftentimes HER2 negative cells as well. Whereas younger women, let's say in their 30s, and we certainly are seeing our fair share of those at Johns Hopkins, oftentimes will have what we call triple negative. Estrogen receptor and progesterone receptor is negative. So estrogen is not what's fueling things. And they also are HER2 negative. Do you think that that may be a contributor to why we're seeing postmenopausal women do better or benefit more from this type of dietary change versus younger?
Yes. In fact, we had some surprising results that consumption of lignans by premenopausal women suggested an increased risk of mortality. At 9 milligrams per day, that's sort of 1 teaspoon of flaxseed a day, resulted in some increased risk of mortality. And so that was very surprising. We need more studies in this area, but we did not expect that at all.
And I'm sure it is disappointing for young patients to realize that something that they have control over, which is their diet, is not necessarily going to be of benefit for them as it would for postmenopausal. But again, the majority of our patients are 54 or older. And I'm sure that at some point there'll be more research done, as there is certainly for developing new chemotherapy agents and immunotherapy agents for triple negative premenopausal women.
Absolutely. Another surprise for me was cruciferous vegetables was inconclusive. I always eat a cup of cruciferous vegetables a day, and it seemed to not have a significant impact. It wasn't harmful, but it just was not positive influence as I expected.
Is it possibly how we metabolize?
So it could be that everyone's metabolism is a little bit different. It could be that the studies that we looked at were less than half a cup a day, which might not be enough. They might need 1 to 2 cups per day. So it could be a couple of various reasons, and more research is needed in that area.
Yeah,
I
absolutely.
will say, for the women who are younger, who are premenopausal, we did find a significant impact from green tea. That was very promising as well.
Does the preparation of soybean, such as dried or salted, make any difference?
So probably not. A substantial portion of the phytonutrients should remain in most preparations of soybeans. So although you probably get a few more phytonutrients if you have it fresh or freshly cooked compared to freeze-dried, I think at least 80% of the phytonutrients stay. Enjoy your salty snack.
We have a tendency to overcook things in the United States. It's like if you cook broccoli long enough, any of its nutritional value will stay in the water. I know that people oftentimes don't like crunchy vegetables, but this is an opportunity, I think, for our audience to know better to not have it be that it looks like a noodle versus still having a little bit of crispness to it.
Well said. Well said.
Yeah.
Or drink the water while you're at it.
Yeah, that's right. Exactly. So are there soy supplements, and are they helpful to take? Like if you went into a GNC nutrition store, is it okay to take off of those shelves things that say soy?
There are so many soy supplements. There are so many soy products and snacks. The thing is, we don't have any placebo-controlled trials to see which ones are better than other ones. So it's really hard to know that the supplement has in it what it says it has in it. And so you really have to look at each manufacturer before you agree to start taking a supplement and make sure it's made by a high quality company.
I'm familiar with Dr. Paul Talalay's research at Johns Hopkins, which he did for over 50 years. And I'll say that again for our audience, 50, not 15, 50 years studying broccoli sprouts, looking at the sulforaphane that is in them and its benefit in reducing risk of breast cancer. One of the things that he did is that he did go into a GNC nutrition store and he purchased a box of a substance that said it was broccoli sprouts in pill form. And then he took it to his lab and he looked under the microscope and did certain tests with it and found out it was alfalfa sprouts that were ground up and put in those little pills. So because we know there's no FDA regulation of these substances, I just want to make sure that our listeners realize that you can't always trust what the label says. And I think it may be better for us if we do have this diet, I'm going to call it a dietary supplement, be real food or real tea, rather than assuming, well, this must be okay, I'll just take this funny looking pill, because you might just be spending your money on nothing or nothing that's going to benefit you.
That's right. I remember Paul Talay well. He actually taught me how to write my first IND to apply for a natural product trial to the FDA. He was a wonderful mentor. That's right. In PC-SPES that was studied in prostate cancer, 8 out of the 32 patients that were studied got blood clots because patients did not know, nor did the investigators, that it was contaminated with a substance that caused blood clots.
Oh, gracious sakes. That's a wake-up call, isn't it? Do you recommend specific plant-based alternative foods such as a veggie burger or other examples?
So for the same reasons that they're not regulated, I'm not against them, but I don't recommend them. I recommend whole food, plant-based nutrition is much better than any processed products.
Okay. Drinking green tea. I can go into any grocery store and purchase green tea, but it will be like green tea without caffeine, green tea with caffeine, green tea that's also we got herbs in it. Is there any instruction regarding green tea? Are all of them okay, or is one better perhaps than another?
This one was exciting for me. We learned that consumption of green tea suggested a 44% risk reduction in the recurrence for stage 1 and 2 breast cancer with pre-diagnostic intake of green tea. So the greatest effect was seen consuming 3 to 5 cups per day. So after the results of the study came out, I started listening to my mother and drinking green tea daily.
That sounds like if you're going to make one change in your diet, that should be the one to make. Now, you commented that individuals were drinking this also pre-diagnoses, which makes me go back and think about Asian women who are already have incorporated into their diet when they're toddlers or even smaller than that. Was there a way to measure how long someone had been drinking green tea? Like, was it best if they had been on it 5 years or 10 years or 1 year?
That is a great question and an area of future research, but unfortunately the studies we found did not take that into account.
Didn't specify that. Well, you still found out they were drinking it before they got diagnosed. So that unto itself tells us, I think, quite a bit. And the real benefit of just that one change in your diet. And it's financially doable. Sometimes we recommend people do things and it's a good idea, but if they can't financially afford it, it isn't going to happen. Or it would be a very slim possibility that in fact it would happen. With broccoli, do you recommend it be what I call adult broccoli, whole grown broccoli, or what Paul Talalay encouraged, which was broccoli sprouts? So they were just 2 to 3 day old, or I'm going to say baby broccoli.
Both are excellent and good sources of sulforaphane and these other phytonutrients that we talked about today. So they help with cleansing the liver enzymes and the liver in general. I'm a big fan of all of the cruciferous vegetables in any stage of growth.
So I want to share with you a unusual story. A friend of mine, his wife, had a very long psychiatric history. He took wonderful care of her. When she was in her early 60s, she was diagnosed with breast cancer. And I didn't feel that she should be allowed to attempt to make any medical decisions for herself because she was more inpatient psych than outpatient psych. He said, no, I'm going to let her decide. And I thought, this isn't a good idea, but he did. And she told him that a voice, heaven forbid, told her to eat broccoli and only broccoli forever. And so that's what she did. She only ate broccoli, which meant my friend also was forced to eat broccoli. Unless he fixed something for himself, here comes the broccoli. He got kidney stones from the broccoli. In any case, she did this for 8 years. And the spot that they had biopsied, and I even had her pathology reviewed at Hopkins to make sure, does she really have breast cancer, went away. And I thought God did that because he knew this woman would not be able to handle having surgery and chemotherapy and radiation and hormonal therapy. It was estrogen receptor positive. A few years ago, she was traveling by herself, which I also thought was a very big mistake. She fell in the airport in Kansas City and broke her wrist. Mm-hmm. So my friend, her husband, was contacted and he flew out there, and she believed that cosmetics would cause you to get cancer. So she made her own cosmetics. She had baby powder for her foundation, if you will, beet juice for her blush or rouge, and she dyed her hair with carrot extract, which of course turned it orange, including her scalp. And I forgot what she used on her lips, but she was a little scary looking. He got there to the recovery room and they said, your wife's over there, just kind of pointing to the general area of the recovery room. And he went over and he's looking at these people, and all of them had on the OR bonnets because he couldn't see her hair. And someone had washed her face. And he said, I can't find my wife. Nurse said, where she says, your wife right here. He says, by God, we may have found Amelia Earhart. So I think that though she was a very strange bird, a sweet gal, but a very strange bird, she may have been a study of one, but she was eating over 6 pounds of broccoli a day, which I don't recommend eating that much. But that was her theory because the voice told her to eat only broccoli. And so
Impressive.
she did. Yes.
Did she also lose a lot of weight?
She was already quite lean. She did lose some, but not as much as I anticipated. But her husband was the one that really suffered since he didn't eat 6 pounds. She wished that he would, so she wouldn't have to fix anything else for him. He'd have to fix his own meal. But whenever I see any studies and I read about broccoli, I automatically think about this lady, of course. Is there anything else you'd like to share with us today, Dr. Paller?
Well, this has been a lot of fun. I've learned a lot of fun stories from you as well. I would remind everyone that prevention is the best strategy and that the NCCN panel recommends annual screening for mammography beginning at the age 40, as that is the greatest benefit into mortality reduction.
Well, we look forward to hearing more news in the nutrition department as to how we can have some control over early detection and hopefully even prevention of breast cancer. Breast cancer remains the most feared disease of all women. And I think that it will, as long as there are individuals who had a total radical mastectomy done and are still alive to tell that horrific story. We've come so far in the treatment and certainly have come a very far way for survival. But the number one issue for women once they have been diagnosed is fear of recurrence. So if this is something we can control and start incorporating soy into our diet, let's start with green tea and see what we can do. Thank you so much, Dr. Paller.
Thank you. Lillie,
If you live in the Maryland, D.C., or Northern Virginia area, we hope that you will join us at A Woman's Journey's 30th anniversary in-person program scheduled for Saturday, November 23rd in Baltimore. We will be offering a powerful opening keynote, and attendees will be able to customize their morning by selecting 3 out of 9 seminars presented by Johns Hopkins medicine experts. To learn more about this in-person event, please go to hopkinsmedicine.org/A Woman's Journey. You also can visit our website to subscribe to our complimentary monthly e-letter, receive information about upcoming podcasts, and sign up for our upcoming free Healthy Conversations That Matter webcasts. Again, thank you so much for joining us.
Thank you for having me.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey acknowledges unrestricted educational support for our podcast, Healthy Insights That Matter from Astellas. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/A Woman's Journey. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/A Woman's Journey. Until next time, stay well.